Welcome, everyone, to Cancer Convos with Grace B. This is your host, Grace B, coming to you from New York City, the city that never sleeps and is home to Cancer Convos with Grace B. I would love to appreciate all of you for the amazing support and for connecting and engaging on my platforms on Facebook, on Instagram, and YouTube. I'm truly, truly humbled. Thank you so much. For those watching for the very first time, Cancer Convos with Grace B breaks down cancer into bites of information and create awareness for you, the patient, for you, the survivor, and for you, the caregiver, and to ensure that you participate in your treatment, your healing, and your aftercare. So this is all for you to thrive. Do find time to do your medical checks. Health is the real wealth. Question everything, research everything, seek second, third, or even fourth opinions. On today's show, I'll be discussing something entirely different, and that is, what does a cancer diagnosis mean for mental health? Cancer doesn't just affect the body, but also the mind, and many people will experience significant changes to their emotional health during this period. Being slapped with a cancer diagnosis can have a very big impact on a person and their loved ones, and feelings of depression, anxiety, and fear are very common. So it's very important to remember that there is hope and help available, and many cases of mental illness can be treated. It's not easy though, because depression creeps up like a thief in the night. Ask me and I'll tell you about it. PTSD doesn't just occur only to those who've been in conflict or to veterans who have been in the line of battle or something. Many cases of suicide have been reported as a result of a cancer diagnosis. For those of us who have gone down this road, our mental health is constantly on the front burner. So, on today's show is a very good friend, a great brother, an amazing cancer survivor who is doing wonderful things in several vulnerable communities by using his platform, Uncomfortable Revolution. I was very ecstatic to have been invited to participate in his project, which is a documentary of which the full length will be aired in the very near future. As we go along, you'll get to know what his platform is all about. So, ladies and gentlemen, without much ado, I present you Brendan McDonald. Welcome to the show, Brendan.
Hi, Grace. Great to be here. Good to see you.
Thank you so much for joining me to disseminate this very important talk on what cancer means to our mental health.
It's great. Can't wait. Go for it.
Thank you. I hope you're well relaxed now after your jet lag, because you've been doing a lot of travel. Very hard to pin you down, but thank God you're here today.
And I'm in Spain, for those who don't know, and it's very hot day. So it's inside, it's like 30 odd degrees. And so if I'm a bit tired, it's the heat.
I know. No, don't worry, you won't be too tired. This is your passion, so you won't be. So, before we dive straight into the talk, I would love the audience to know a bit about you. Please take us down memory lane as briefly as possible. Place of birth, family, education, all that you feel we would be interested to know about.
Family. Okay. So I was born in Australia, in Melbourne, to a South African mother and a Welsh father.
Yeah.
And grew up in the city mostly. Went to Catholic boarding school in the countryside. Then spent around 10 years in the Australian Army, and then left the Army to start a career as an aid worker, initially in Macedonia and Kosovo, and then into North Korea, and then from there, everywhere from Libya, Iraq, Jordan on the Syria response, tsunami response in Sri Lanka, civil war in Sri Lanka. Yes, about 20 odd years in the aid business. And in terms of education, my last degree was a Master's of Social Science in International Development.
Wow, excellent. That's nice. And your career has just been what? Because what they don't know is that you're a UN person. That's where both of us actually connect as well.
Yes, indeed. So yeah, most of that was actually with the United Nations, starting in
Mm-hmm.
North Korea until Iraq was my last job.
Yes, that's great. So what would you say have been the experiences that have shaped you in being what you are today?
Um, Reflecting on this, I mean, we're all a makeup of our genetics. So the hidden dust of our ancestors filter through to our bodies today, and we can't see what they are, but obviously how our grandparents and forefathers behaved, whether it was about happiness or anger and emotions, that filters into your brain still today. So the big things I think that influenced me, my father used to always say that a man should never have to rely on anyone. So whether it was sewing a button on my shirt, doing my own ironing, doing my own cooking, he was adamant. You need to be able to look after yourself and not rely on anyone. Reinforced in boarding school, although you had good friends, you very much had to look after yourself. And then, of course, being in the army, which is an incredible team environment, and
Hmm.
it's very hard for people to understand what army life is unless you've been in it. Great camaraderie, great people, but you still have to be quite stoic. You know, it's not a place where you're encouraged to wear your emotions on your sleeve,
Yes.
and you are rewarded for your ability to manage your emotions and conceal, anger and fatigue, particularly.
Right.
Uh, and I think being in the United Nations didn't really change those views. And perhaps my experience in the army frustrated my time in the United Nations because I'm used to very well organized bureaucracy, very disciplined
Hmm.
process to get things done, which
Yeah.
doesn't always happen in the aid world, but different
Yes.
environments, different
Very
environments.
different, very, very different. And that's probably why, you have been as stoic as you are, because you've been able to integrate both experiences, you understand, and being able to move forward. So how did you come to be diagnosed with cancer, and what type and stage was it?
Okay, so I was diagnosed with chronic myeloid leukemia in January 2015. And like a lot of people who have uh, this type of leukemia known as CML,
Hmm.
it was diagnosed because of another medical appointment, a blood test. And funny enough, I normally do an annual checkup up until I do more than that now, of course, with cancer, but up
Yes.
until my diagnosis, an annual checkup. And I saw this regular doctor in Switzerland for about 5 to 6 years. And I was listening to a BBC podcast which said, if you don't feel sick, don't do checkups. It puts a strain on the healthcare system. There's could be false positives. Do your mammograms and your prostate and bowel cancer exams, etc. But not just going every year. I was like, okay, that makes sense, and I felt healthy. But my Swiss doctor, being Switzerland, said, Brendan, if you cancel, because you're cancelling within 24 hours, you have to pay the full fee.
Hmm.
So I said, fine, okay, I'll go this year because why waste the money? Uh, so we did the blood test, followed up on some heart issues that I've been having, and did some more tests. Then he said, I'll see you Friday. He called me on Thursday and said, I can't possibly fit you in on tomorrow. Let's see you on Monday. I said, okay. I saw him on Monday and he said to me, Brendan, I've got good news and bad news. And he said, good news is your heart's great. I said, oh, wonderful. He said, bad news is you have leukemia.
Oh my goodness.
And pretty much after that, it's just blah, blah, blah. I mean, I have very little recollection of what he said afterwards, apart from there's been a lot of research in it. And then I'm sure he said to me something about the Lira Vera. And then I walked out of the clinic being diagnosed with leukemia.
Oh my goodness. Did you have any symptoms before the diagnosis, or did you feel uncomfortable? What happened? Did you
So,
have a feeling something wasn't right?
so at the time, I did not. But when I
Okay.
learned about the disease and learned about the symptoms, particularly early symptoms, it was clear I had them. So I was working in Iraq from June, July 2014 to December 2014. And it was a very busy time in Iraq. I mean, ISIS was on the move. There was the Yazidi population displacement, millions of people displaced. And we worked very, very long hours. Um, not the best food because we were in a compound. And I was exhausted. And a couple of times during that period, I started getting night sweats. So I'd wake up in the morning and my sheets would just be drenched in sweat. But I didn't think anything of it. It was just like, oh, that's odd. I sweated during the night. And particularly in Iraqi summer, it's 40 degrees at night, so
Yes.
normal.
Normal.
And then some days I was just so tired. And I thought, okay, must be because I'm not looking after myself. I can't really exercise or eat well. And I'd be getting the odd headache, slight loss of appetite. And these are all actually signs of leukemia. But they're also signs of being
Cancer.
exhausted. Right?
Yeah,
Cancer generally, in fact.
Generally, yes.
So generally, for a lot of, and the thing is, if you wait for these symptoms to become full blown in leukemia, it's much harder to get cancer under control, similar to other cancers. So early detection is key, and I was lucky that I was detected early.
Oh, thank goodness. So what did the treatment entail? Please walk us down this road.
Well, so he said, we'll get you in to see a specialist. And I think it took, my memory's still blurred from this time, a number of days, maybe a week to see a specialist. And then she said to me,
1 week.
Yeah, and then she said to me, oh, I'm a specialist in acute myeloid leukemia, not chronic myeloid leukemia. And then she said, go see this other person. So about 10 or 11 days, maybe 2 weeks until I actually saw one. And of course, when you're told you have cancer in your body, even though I'd done some research on Google, which I shouldn't perhaps have, it's like I want it out of my body, right? It's like cancer, you can't really get it out of your body.
Yeah.
So eventually I saw a wonderful Swiss doctor, and she did a confirmatory diagnosis, which is done through a bone biopsy, which is not pleasant at all. And then she put me on the standard first line medication called Gleevec, which saw my white blood cell count plummet. So I was at 55,000, and it dropped down to like 10,000. The presence of cancer dropped like threefold in my blood. And all was going well. Then around the 3-month mark, at that stage, I think I was being tested initially, I think every fortnight might have been, and then shifted towards every month. Then the cancer went straight back up. So her concern was either I hadn't been adhering to my medicine, which is a common issue with a lot of chronic illnesses. People don't take their medication as instructed, or she was very concerned that I might have had a genetic variation, which wasn't responding to the drug. Fortunately, she then switched me to a second generation, now third generation, I guess, drug. And I responded to that, but it had quite nasty side effects.
Oh dear.
And then I switched eventually to another drug, which had worse side effects, but it was, the side effects weren't as bad as the second drug, but it was 2 tablets in the morning with 2 hours fasting before and afterwards, and 2 tablets in the evening, 12 hours apart, 2 hours fasting, 2 hours afterwards. And they were, that'd be really rigid. So even traveling, you weren't supposed to adjust that time, that 12-hour gap. So for me, adhering to that tablet regime for the rest of my life didn't sound good. And then eventually I switched back again to another drug, which has worked well, but still has side effects.
Oh boy, that's something. Oh my goodness. And what was your reaction? I mean, what was happening at this time? Your reaction, those close to you, I mean, your mental state. What was it? What was your first reaction to the news actually that you had leukemia?
I actually remember the day relatively well. I Googled chronic myeloid leukemia when I left the doctor. An older result came up which talked about, and again, these numbers, maybe it was like 40% survivability for 5 years. And they were talking about the cancer historically, not with recent medications.
Mm-hmm.
And I decided to ignore it. I said, I'll put that leukemia in a box, pack it away, and just pretend it's not going to happen.
Mm-hmm.
So I think there was in denial was my first response. And that I would live my life as normal and nothing would change.
Yeah.
Yeah, I was a bit wrong about that.
And those close to you, I mean, your spouse, your wife, the rest of
My, my
your children. Did your children know too at this time?
No, not at this time. My girlfriend was incredibly supportive. Now my
Mm-hmm.
wife.
Mm-hmm.
Other friends around me were very supportive.
Mm-hmm.
Obviously, my mum was in shock because she was in Australia, and of course she doesn't know. She gets told you have leukemia, but don't worry, mum. The kids didn't know for about 6 to 12 months. I think we decided that. I spoke to my ex-wife, but I think the decision was, and they were quite younger. It was 5 years ago. That
Yeah.
better not to tell them right now, especially since I was in Geneva.
Mm-hmm.
But tell them a little bit each time I visit. So I explained to them, that to use the language, Daddy has an illness. It's called leukemia, and I take medication. It's what the medication does to my body. That's why sometimes I don't have the energy that I used to have.
Mm-hmm.
And kids are fine, I think not telling the truth to the kids, and of course it depends on the age, does more harm than simply just being upfront.
True. I
When you're
agree.
talking about
Yeah.
cancer or death,
You have to be as honest as possible.
yeah.
Yes, indeed. At this time, did you think of the worst? Did you actually, were you intentional in your thoughts? Did you believe that, oh yes, like you said, you put it in a box. That already had shown that you were intentional about how you were going to go about it. It didn't exist. You were in denial. But at the same time, you could be in denial, but you still have something lurking at the back. Did you think of the worst? Did you believe you would overcome?
Well, I've always confidently quoted Shakespeare, which is, it seems to me most strange that men should fear death, because death becometh once to all men.
True.
So it's like, why should you be fearing death? Because it's gonna happen. It's one thing we all share.
Mm-hmm.
And I've had lots of friends die, some from cancer, some killed in aid work in the army.
Mm-hmm.
So it's never been sort of a real sensitive issue for me.
Mm-hmm.
But when you start thinking about, oh, this is now more real
Mm-hmm.
than it was previously.
True.
So, and I think it took me, I saw a fantastic psychologist in Geneva, and he helped me a lot talk through these issues of mortality, about how to cope, I guess is the right word, manage, live with cancer.
Yes.
And the cancer put a lot of strain on my relationship, my marriage, my friends, my
Mm-hmm.
work environment.
Mm-hmm.
Because
Obviously, I mean,
it did, but I was in denial. So I remember a psychologist tried to put me through this exercise, which I found really hard. Because he
yeah.
tried to have me sit down in a chair, and then he said, he
Talk.
put a chair next to me and said, now I want you to talk to your cancer.
Hmm.
What are you two going to say to each other?
Oh my goodness.
And I wasn't bad at a drama when I was like 7.
I can imagine.
Theatre's never been my forte. So that particular technique did not work. But
Talk
he
to your
did,
cancer. Oh my God.
but he did help me tackle that issue. And the thing is, often cancer, certainly in my case, doesn't happen in isolation from other things that are happening in your life. Relationships, dissatisfaction with work, other issues in your life that perhaps you've ignored in the past. So sometimes all of these things bubble up together. and recognizing how cancer intersected with issues around work, or my previous issues with burnout or relationships, or issues with my children. He helped put a lens on that to make it a lot clearer.
Fantastic. So in other words, you didn't actually approach him for some mental, should I say, intervention. He was the one that advised you, or he just said, listen, we're going to talk about this. I'm just trying to see if you approached him, if you found out that you weren't coping in that department, or if he just said, listen, something could come up in the future, let's talk about this. Why I'm asking was because when I was told about my diagnosis, I was asked if I'd need routine mental health screening in oncology settings, because they advised that the self-report tests, there was something to do with self-report tests, which you had to do on your own. They were quick, easy, and inexpensive. So I'm just trying to find out if you sought mental intervention, or the psychologist said, hey, Brendan, I think you would need this. Let's talk about this.
I actually think it was my wife who encouraged me to see a therapist.
Okay.
I'd previously seen him for burnout,
Okay.
which I experienced. I did 12 months in Jordan coordinating the information analysis of what was happening inside Syria.
Mm-hmm.
And for issues only to do with management and internal work stresses.
Mm-hmm.
The end of the year, I was shattered. I'd never been so tired and exhausted in my life. And
Mm-hmm.
the year, I then saw one therapist and then another therapist, and he helped me really work through these issues.
Mm-hmm.
And because I had trust in him, I went back to him again.
Mm-hmm.
But strikingly, though, in Switzerland, the doctors never mentioned mental health.
Mm-hmm.
And I'm not sure, and I don't like comparing diseases in the sense of, as a pain is subjective. So each of us carries pain differently, whether it's emotional pain or mental pain.
Yes.
Each cancer is different. Each person has a debilitating illness, whether it's, MS or cystic fibrosis, etc. Each carries its own challenges and difficulties.
Yeah.
But I'm not sure whether because it was a blood cancer and very much this concept of you look okay. Right?
Yeah. You
You're
look
still
okay.
walking, right?
Yeah.
You haven't lost your hair.
Mm-hmm.
There's an underappreciation of what it actually
What
does to
one
you.
is going, yes, what one is going through.
So we went to two very good hospitals, in one in New York, Memorial Sloan Kettering, and Mass Gen in Boston, and they never talked about mental health. Never, not once. It was just not even discussed.
Oh my goodness.
And so maybe they thought, oh, he looks fine. He's not mentioning there's a problem, we won't. And by the time I was actually in the States, it wasn't that much of a problem mentally. Whereas you think, and the various Facebook groups I'm in that look at just people with this cancer. One run by an Australian lady, Sue Hart, who is awesome as a moderator of the group. It's something that a lot of people with CML talk about, is a lack of empathy from doctors. So even if you read the side effects inside the box, then you do your research online and say, in the trials, this is what people felt. And these are the reported side effects of people. And this one is rare, but it's 1 in 100, and I'm experiencing it. A lot of doctors are dismissive of the patient's reality.
True.
And that's a lot of why the Facebook group is so good, is that people turn to other people with CML for validation. Hey, I'm getting this skin rash. Does magnesium really help? This is what my doctor said. And people chat and compare doctors.
True.
So I think that, doctors are amazing and I have enormous respect for them. But I think sometimes on the doctor's side, they're still stuck in that paradigm of there's physical health and there's mental health.
True.
Right?
I agree. Absolutely. Absolutely with you. I
And the
agree.
invisible illness, particularly around mental health, I still struggle with in terms of, because I was brought up in a world where I was always taught mental health didn't exist, and that, if you have a mental illness, you should just wake up and smile and be happy, choose to be
Mhm.
happy. And because that was hardwired into me as a child, right? That is sometimes how but I'm not thinking, I default like, oh, that must be the case, right?
Yeah.
Whereas, of course not, it's chemical. It's as
Hmm.
real in the body as anything else.
True. Absolutely. Especially not just cancer survivors, everybody that's going through something. I mean, we are all survivors one way or the other, and we often experience a whole range of positive and negative emotions. Relief, especially with us, gratitude to be alive, and then fear of a reoccurrence. And then you have anger, then you have guilt, then you have depression, then you have anxiety. Just you going through all those emotions. I mean, it's too much to bear, I swear. Even our family and friends and caregivers, like you rightly said, go through, all that. Is that anxiety disorder? It's crazy, you know. Especially when we have survived and we're doing well relatively, thank God for that. You think, oh, why are we still here when others were not better than anybody else? But why are
Yes.
others surviving? I mean, why are we surviving and others have gone? So you now have that survivor's guilt thing playing, and then everybody's like, well, trying to make you feel better. It's a crazy thing. So,
Indeed.
like you said, um, your treatment is ongoing, right? Because
Yes.
you're still taking medication, you're still, you know, tell us what you're still doing now since it's ongoing.
So I still take a tablet every day.
Hmm.
Um, and that causes sort of three notable, it causes many side effects. So the sort of three significant ones is it causes edema, so retention of the water in the body,
Yes.
which raises blood pressure.
Hmm.
So I need to take a strong diuretic, which keeps the edema totally under control.
Hmm.
Um, but a strong diuretic causes significant increase in uric acid in the body. Um, so you have gout attacks, particularly in the joints, um,
Hmm.
which is compounded by me, who still loves a glass of red wine and meat, and love my anchovies and tomatoes, which of course are also high in uric acid,
And
uh,
in sodium.
and in sodium, of course. So I then have to take heart medication, which has those problems. And then I have what's called peripheral neuropathy, um, uh, which we're still exploring, but my Australian oncologist, because I get treated now mostly in Australia, um, she believes it's pretty much linked to the cancer treatment,
Yes, it
right?
is.
And it's a recognised side effect of chemotherapy.
Yes,
Um,
it is.
and the concern from her is that it appears to be slowly getting worse. To
Getting
understand,
worse? How come?
well, the more you take the drug, the more toxic it is in your body. So, and I know that it's getting worse. Um, uh, so
No,
I
does it affects your feet, your hands, right?
so it
Your
affects,
extremities.
yeah. So particularly my right wrist, a lot of pain. Um, I have desensitized skin, so like numb skin from pretty much upper thigh down my leg. Um, Occasional pins and needles, but the most alarming thing, particularly to people around me, is I get electric shocks. Is the only way I can describe them. Where for a microsecond, just an electric shock goes through my leg or my arm or my groin area, and it happens totally random. So
Really?
I can have 3 days where I haven't experienced any of it, and then suddenly, I'm driving and it hits me, or I'm talking to someone and it just hits me, and you have an involuntary reaction of where you just almost scream out, and then
Oh,
the pain's gone. So, uh, and this is where for all of us who are on any medication, my medication actually was the fastest, or the first drug that led to the breakthrough was fast tracked through FDA tests in the US, because they first did the very first patient trials. The results were so good, I think after 3 months, that the FDA decided that it would be unethical to continue with the tests, because they demonstrated such positive results so early, and given that the cancer was a killer, that they just said, yes, go for it, right? Because even if there's side effects, it's better than, not having side effects and being
Not
dead.
having side effects, yes.
So there are questions about long-term toxicity of some of these medications. And I think a lot of research is saying, people on this drug now for 10, 20 years are starting to experience long-term issues, which is still, and we can't blame the drug companies, it's still way better than dying.
It's
just a fact of life.
You just have to manage. It's like breathing every day.
So
you just have to get up and breathe, Yeah.
So now there's a lot of experiments around maybe we're overdosing. There's other issues which affect people. I know it's getting more on the drug side, not mental health, but if I'm 250 pounds, I take the same medication as someone who's 80 pounds, right?
Yeah.
Or, 100, a small lady or a small man versus a large man, a large woman. So the drugs affect different people. So they're trying to think, how do we calibrate the drugs a bit more sensibly? Anyway, off topic.
Absolutely. Going back to the neurotherapy, I still experience that. Sometimes I get tinglings in my fingers and my feet. Well, that was when I was doing chemotherapy. Even after I finished chemotherapy, from time to time I'd have those, pins and needles, like you said. And then there was one time I signed a check for someone, and my bank didn't recognize my signature because I couldn't write, the side effects, I couldn't hold my pen properly. I couldn't, so the bank had to come in and say, listen, you wrote out a check, but we don't recognize your signature, and I was like, it's me, I'm sorry, So I now thought to myself, am I going to be using thumbprints to sign? Because the side effects, the neuropathy was crazy. So going through that is, I don't know, I wish one wouldn't. But it's eased off a bit, I think, because I've just kind of, like you said, just dropped it in a box. If it comes, it comes. If it doesn't come, and then my oncologist said, start using the pen, because it was spoiled with the laptop, so you type away and everything. But my oncologist said, listen, use a pen and start writing as if you're beginning to write again as a child.
Oh, that's a good idea.
Yeah, so that's what actually helped me. So if I have to do notes or whatever, I have pieces of paper everywhere, except when I have to do a report or something, okay, I use my laptop. So a lot of exercise is actually good for that neuropathy, but it's so uncomfortable, very, very uncomfortable. Yeah. Anyway, regardless of what you are going through, you're looking fantastic, I must say.
Thank you.
You are. So one thing that happened to me when I finished, I know you're still ongoing your treatment, but something that happened to me when I finished my treatment was that, after you've been through about 18 months off and on treatment and everything, and you finish, you're left in the cold by your medical team. You understand? So, you had all the attention and all that.
Yes.
Everything was around you. And then all of a sudden, oh my God, the treatment is finished. I'm on my own. It's no more about me. Did you feel that? I mean, do you still feel that, so to speak? Because, like you rightly said earlier, um, once it's finished, it's finished. Your medical team has moved on to the next. So they're not like thinking about, oh, okay, let's see what our patient is feeling and all that. Do you get follow-up visits? Do you, you know, get any phone calls saying, hey, hi, Brendan, how are you today? And all that. Do you?
Definitely no phone calls. No, I have to get blood tests every 3 months, which reminds me, mine is next week.
Okay.
Um, uh, so usually the doctor says, if there's a problem, I'll call you. Yeah,
Mm-hmm.
I prefer they call you either way. They just right, because it's like, because then even though it's possible, but it's highly unlikely my cancer would rapidly worsen. So if I was to fail on the treatment or cancer has come back, it's generally a slow progression.
Okay.
But still, you still want to know rather than try and wait 3 months. And I'm in Spain, and often it is waiting until you see the specialist.
Yes.
Um, and across cultures, the way doctors treat patients, I've noticed, is very different. Having now been treated in Switzerland, Australia, Spain, and Boston and New York.
Mm-hmm.
The healthcare in the US is actually fantastic if you've got great insurance. It's very comprehensive, very patient focused, barring the mental health stuff. Where in Geneva, it was very much. I once had an operation in Geneva for a hernia, and I complained of the horrific pain, and the doctor just looked at me and said, "Brendan, there's no problem. It's just that you have a low pain tolerance. Like, in other words, accept the pain." And in
Oh my God.
Barcelona, it's a lot more relaxed.
Yes.
So I don't feel neglected by my health team, but
Mm-hmm.
what I was very happy about now going to Australia for treatment is, as a military veteran, I have the Department of Veteran Affairs, and
Mm-hmm.
they provide 100% coverage for cancer. And my
Great.
doctors were very proactive straight away. I saw them.
Mm.
First of all, they said, "You're 50 years old. Have you done your PSA test, which is prostate? Have you done your bowel cancer test, which is supposed to do at 50?"
Mm-hmm.
My doctor said, what sort of specific tests have you done for peripheral neuropathy? And I actually said, I met a neurologist who said, that's what you have.
Mm-hmm.
And I went, and she goes, that's not enough. Let's get you in to do some real tests. And she did another scan of my spleen and lower abdomen to check that everything's happening okay. So I
Mm-hmm.
think, and this is all socialized medicine, so everything in Australia is subsidized.
Yeah.
So very proactive care there to say, hey, let's just find out what's going on,
Mm-hmm.
because, and this does play on your mental health as well. You wake up as a person who's had cancer or has cancer, and you wake up feeling tired in the morning, or you wake up with diarrhea.
Mm-hmm.
It's like, is this just diarrhea caused by the medication, which happens occasionally, or
Mm-hmm.
is it something worse? Is this
Yes.
cold going on too long? Do I need to
Yes.
speak to my doctor?
Or this cough or whatever.
You
Yes.
know, or, you know, and I think obviously depending on your cancer, and of course, I think I'm right in this, that if you have one cancer, there's also another chance you can get another, of course, right?
Yes, of
And certainly
course.
for those with CML, there's a slightly elevated risk of secondary cancer. So that plays on your mind, and then you're
Mm-hmm.
saying then you go to your GP,
Mm-hmm.
and certainly in New York, in the States, your GP just goes, "Oh, you've got CML, go to your oncologist."
Mm-hmm. Straight
Right? Which
ahead.
Australia, at
Yes.
least in Australia, it was like, no, I'll deal with you on some issues as your
Mm-hmm.
general practitioner, as your family doctor, but your oncologist will deal with other issues.
True.
So sometimes I think that, and this is actually sort of links to the company that I founded with my wife, U Revolution, is
Yes.
that
I'm
the
coming
whole
to
issue
that.
of
Yes.
whole issue of advocacy for people who have a chronic illness and disability,
Mm-hmm.
about the need for people with an illness or disability to speak up and defend themselves, particularly in a world that either doesn't understand what you're going through or isn't accessible to you, is really important. And when I looked at my experiences as a person with cancer, even though I do not know what it's like, for example, to be a paraplegic or a person with cerebral palsy. There are some similarities in what we all deal with, which is a world that is built for people who are healthy and are able to get around. So whether it means when I travel, I get exhausted sometimes at the airport.
Yes.
But I don't want. Sometimes I think, oh, do I want to get a wheelchair because sometimes I'm really tired today? It's like I know everyone will stare at me
because they'll look at you and say, "Hey, he looks healthy.
oh, and he got up to walk around to get his bag.
What
Oh,
does he
that's
need
great.
a wheelchair for?" But they don't
Of
understand.
course. And then it's the issues around, particularly in the United States, access to healthcare. So the positive side of my cancer was being able to recognize this intersection of an illness and access and rights issues. Basically, it is a human rights issue, which I've turned around now into the company.
Yes. And you're the co-founder of Uncomfortable Revolution. I mean, you and your wife are in it together. Please just go back again and just give us a synopsis of what the project is all about.
So, You Revolution is a lifestyle brand and magazine that covers issues that affect disabled people with chronic illnesses, as well as their carers, their work colleagues, their friends, their families. And you think about WHO says something like one in 3 people have a disability.
Yeah.
There's a lot of people in the world who this touches. And we look at covering issues that affect those people, whether it's cerebral palsy and sex, whether it's issues around African American women with HIV and how they're disproportionately likely to suffer an early death compared to non-people of color who have HIV in the US. So it's very broad. We talk about cancer, we talk about cancer survivors, which is the project that we worked on, which hopefully we'll have these videos coming out. And all of it really at a sort of mission level, so a high vision for the company, is that we want a world that's more inclusive. We want a world that is more accepting by including others who have illnesses.
Yes.
But it's early days yet, so the company is new, and we seek to be we're a social enterprise. So my wife has her own disabilities. We nearly only employ people who have a chronic disability, chronic illness, or who are disabled. And what we're finding is that there is a huge number of wonderfully artistic content creators, photographers, journalists who have, either a visible disability, a lot of them invisible disabilities, which is another issue, or chronic illness, who for some reason find that conventional work isn't accessible for them. So a company like ours can produce engaging content and make amazing products that are interesting to people, no matter whether you have an illness or not, whilst providing an income stream to a number of people who otherwise wouldn't have that income stream.
True. And for you and your darling wife and even the people that you have employed who are working on the project with you, would you say that this project has been part of your healing process? Because for me, what I do now has made it possible for me to be connected to a lot of beautiful people on the way, and has helped me inspire others going through our similar situation, and has made life kind of bearable as one is giving back. So has this happened to you too?
I think at the start I would never have said consciously it's part of a healing process. But I think in hindsight, one of the when I was in the United Nations, by chance I was often at the center of things. I was one of the first UN staff members into Tripoli during the middle of the Civil War, in North Korea for 4 years, Iraq when the world was watching us, with Sinjar and the Yazidis being massacred by ISIS.
Yep.
And you are talking to New York and the journalists, and your day job is on the front page of every newspaper in the world. So you have an overinflated sense of self, an ego, right, which you attach to your job.
Gotcha. Yes.
Right? And you're unable to separate your job from you as the individual.
Yes.
So one thing that I work through with my therapist is to better recognize that you are not your job. Right? You are you. And this happens a lot when people retire, not that I retired as such, that there's this great sense of loss about what's been left behind. And I recognize now that I did feel, and sometimes still do feel, that sense of loss of doing what I used to do as an aid worker.
Yes.
But now, having co-founded this with Corinne, it's helped me heal because it's given us a cause to work on. Because I have a disability that, again, not outwardly visible, but when I was first couple of years after cancer diagnosis, I struggled to pretend I could work normally, and I was doing a disservice to my organisation and to my colleagues because I couldn't. And the days that I worked full time, I would come home and just be exhausted, irritable at work, although I was ruthless at prioritising, which is a good thing. And finally, the United Nations said, "Look, Brendan, you can't do this job anymore." They didn't say you can't do any job. It was, you can't be a senior humanitarian affairs officer that goes into emergencies,
situations and working, on the front lines and all that.
And they said it is no different to someone who is in a vehicle accident or a mine accident and loses a leg. You just can't do this anymore. And we have a pension scheme that you pay a lot of money into, which enables you to have protection and get a disability pension like retiring early. And they were the ones who were incredibly supportive in doing that. And I did not want to do it for a long time. But then having that financial security has given me the flexibility to work. So, last week, I was just tired, 2 or 3 days of just where you just can't do anything. You don't want to get a move. Your body just
shuts down.
Exhausted. And you don't know why. And maybe I haven't been exercising much, but it becomes a vicious cycle of exercising and fatigue. So I don't work much. I just put the laptop down. I might just go for a walk, read a book, relax. And no regular employer would let me do that.
Yeah.
Right. And this goes back to sort of the social enterprise part of the organisation, the U Revolution.
Organisation.
Is that a lot of people are like us who can't work full time, or a regular traditional workplace isn't accessible. If you're an autistic person, and of course recognises it's a very big spectrum of autism. If you're an autistic person who struggles to survive in a workplace, well, maybe there's ways we can make the workplace accessible for you. If you're a disabled person, how do we make that workplace accessible? And for cancer survivors, their return to, even though cancer survivors are living longer than ever before, their return to work rates are incredibly low.
Very low.
Particularly for the over 50. So if you think someone like yourself has a wealth of knowledge and experience, imagine we're in a world where we couldn't work anymore, couldn't give back.
Yes.
And
that would be more depressing. That would be more depressing.
Yeah, on the mental health of people.
And
it would
worsen.
And you lose everything. Yeah.
Yes, it would worsen, because even having a mental health condition while living with cancer worsens the outcomes, worsens the outcomes. That it's been found that people with depression have worse cancer-related outcomes.
Yeah, people with clinical depression live a shorter lifespan than others.
Yes.
That's proven now, I think.
You see what they do. They deliberately miss appointments or therapy appointments. So much happens, and that I think I was reading somewhere studies also show that dealing with severe mental health illness, dementia, substance abuse, and all that are more likely to lower the chances of survival, because you can imagine somebody comes out of has done so much, has been um, faced with cancer, has done treatments, comes out and is depressed, and now starts taking drugs. You
Yep.
understand? And other substances that worsens everything. So, and their chances of survival even are zilch.
Yeah.
And a lot of them commit suicide. We see that happening a lot of times. So many cases of mental related illnesses as regards cancer resulting in suicide is on the double. Is on the double because
Yeah, and then well, Grace, what I think you're talking about is an absence of patient-centric care, which is something that has been known about for years, is put the
yes,
patient in the middle and the medical people surround them, whether it's
around.
psychiatrist, psychologist, doctor, dentist, whatever,
Yeah.
rather than putting the doctor in the center, and we have to chase around till we
We
figure
have
out.
to go around looking for, yes, I understand.
Absolutely. Yeah.
Yeah. Once the patient is the nucleus, then it makes, things better. Yeah, every patient wants to know that they're first, their priority. They don't
Yeah.
have to start running around a doctor, a nurse, a caregiver, whatever, and that actually helps, the mental side of it, which we really have to go through.
True.
Yeah. So, are there any words of advice you'd like to give somebody that is facing leukemia or any other thing? How to go about it, how to cope, what to do? Being that you're living this, and by the grace of God, you will survive for a very, very long time. We will survive for a very, very long time.
Possibly. I guess I'd not necessarily, I wouldn't say advice, but
Or some wisdom nuggets,
okay, some nuggets.
yes, some nuggets, yes.
I think everyone's journey in life
Mm-hmm.
is alone. You have people with you, you have people helping you, supporting you, but it is ultimately your journey.
True.
And some people in life get buffeted by the winds and events and don't react to them and don't take control of their own lives. Others are more in control. So when it comes to a chronic illness like cancer, or acute illness, unfortunately for some, uh, people look at others' experiences and judge themselves. Oh, Mary survived. Why am I the one that's dying?
Mm.
John seems to be running around on his leukemia medication, and I'm not. What's the problem? And
Mm.
vice versa. So I think the key is try not to judge anyone else's,
Or compare.
or compare. Perhaps is a better word than judge. Your body is unique, and
Mm-hmm.
how you respond to the medication. Of course, there's some commonality. Otherwise, the cancer drug wouldn't work. But
Yeah.
how I respond to my cancer medication is a little bit different how someone else will respond. Right? That's why our blood tests are different each week.
Yeah.
Each time we take blood tests,
Sure.
mine blood is different slightly to someone else with leukemia. And our brains are very different, and they have their own chemistry as well. So how our brains and our experiences cope with cancer is different. So I think it's useful to know about others' experiences, and I think it's useful to listen to others, or sometimes you need to validate your experiences with other people with similar conditions.
Mm-hmm.
But definitely don't compare. And then the other nugget of wisdom is you need to become your own doctor.
Mm-hmm.
And I don't mean Dr. Google and Live Strong.
Mm-hmm.
Take the time to read the medical journals. If it's about cancer, go to the American Cancer Society. Don't or
Exactly.
go to Mass Gen or
Or
Memorial
Lancet.
Sloan. Yeah,
Yeah.
or Cleveland Clinic. Go to the top medical sites in the world and know about your drug and your condition, and do not be afraid to have that conversation with your doctor.
Mm-hmm.
Right? And finding a good doctor is sometimes like finding a good life partner or a date. Right?
Yeah.
It's okay if you and your doctor don't get on. It's like, oh, I've gone to this therapist and it just doesn't work.
Mm-hmm.
Okay, I'm going to go to another therapist. Or if you feel
Yeah.
uncomfortable, and again, this is a luxury I have. I know many people don't have this luxury. If
Mm-hmm.
your if your therapist, or sorry, your oncologist is dismissive of you, find another
Yes.
oncologist. Speak to the head of the department. Um, that's the other thing I would do. Be very proactive in your own healthcare.
Mm-hmm. That's what I keep harping on. Ask questions, read. Don't just listen to yeah, we should listen to our doctors, but at the same time, you find out that a lot of doctors are not even upping their game. Do you know that? They're not reading, they're not finding out what is happening. A lot of patients like us seem to know more than our doctors now because we're more concerned. We want to know, okay, what's going to happen after this, or what's happening in our world now and all that. I'm not saying for all doctors, but survivors, patients like us that have been through that don't want to be caught napping. You know,
Yeah.
we want to know. Oh, okay, there's something new that's out. There's a clinical trial. Because people around us are suffering from a lot of stuff. So at least you can share that experience or that information with other people to say, listen, this is what I just heard. Go for it. You know.
Indeed.
Yeah. That's great. And let me see. So, the mental health aspect, um, we must be intentional, like you were. Um, we have to be proactive, first of all, and we don't compare ourselves. Once we start comparing ourselves, of course, depression and mental health problems come onto the fore. So these are things that we have to try to avoid, as you rightly said, and so I think we're done here. Your take on mental health and cancer and all that has been very eye-opening indeed from your angle. I know that you've shared so much information regarding this topic, and we'll continue to come back to you to ask you
No worries. Anytime.
questions. So don't consider me a pest, okay?
No worries at all.
Thank you so much, Brendan, for finding time to share your words of wisdom and your expertise walking down this road, this journey, sharing your light with us and all that. So, my dear listeners and the audience out there, please like and follow Uncomfortable Revolution on Facebook and also on Instagram, and so that you can know exactly what Brendan, his wife, and his team are doing. They're doing an amazing job, and as time goes on, by the time we finish that documentary, you guys will actually know what it's all about. So a gentle reminder to everyone that once you're faced with a trauma, please seek emotional help. Recognize your emotions. Don't go it alone. Most people who end up taking drastic measures like suicide and all that are usually found to be in isolation, very far from the crowd. Don't be far from the crowd at all. Surround yourself with people as best as you can to stop the devil from using your brain. So, my dear audience and friends, there you have it. Thank you ever so much for listening and to supporting the course. If you haven't yet joined our community on Facebook, please like us on Facebook at Cancer Convos with Grace B. Subscribe on YouTube as well, Cancer Convos with Grace B. I don't think you'll have anything to lose. See you very soon for another interesting topic and amazing guest. Thank you so much, Brendan. Thank you so
Pleasure.
much. Blessings to you. This
See
is
ya.
Grace B. See ya. This is Grace B signing out, wishing you all peace and light. God bless. Mhm.
There you go.